Well, if you think getting a doctor appointment is difficult now, just wait. The Defense Department is currently planning to eliminate about 18,000 uniformed medical personnel beginning in October. 10 of your side, Stephanie Harris, has been looking into what this could mean for military and non-military families here in Hampton Roads. Stephanie?
Tom, what we know is that the military plans to cut positions, including doctors, dentists, nurses, medics, and support personnel. What they're not saying is who will replace them or what military families will do. I've been working for weeks now to get answers. Portsmouth Naval Medical Center, Langley Hospital, Boone Clinic. Thousands of Hampton Roads families depend on these facilities for their health care. But when the Department of Defense takes an axe to the staff, cutting it by 20%, the Military Officers Association of America asks,
what happens then? Well, when those services aren't provided by people in uniform, people will be sent out to the TRICARE networks, to civilian providers.
And that begs the question, what will happen at those civilian doctors' offices?
There may not be the civilian network capacity to take care of all of them.
Or to take care of civilians who may already find it difficult to get an appointment. The DoD's goal in eliminating the positions is to streamline the military health system. Their mission is warfighting, and this is an effort to provide more effective and efficient care on battlefields and through military treatment facilities. But how will it affect troops, families, and retirees? I reached out to the DoD and have heard nothing. As far as Naval Medical Center Portsmouth and Boone Clinic are concerned, a spokesperson for the U.S. Navy Bureau of Medicine and Surgery told me they have, quote, no specific finalized information they can share at this time. But think about what you need for military readiness and what you don't.
We can estimate that the specialties of pediatrics and obstetrics, we have been told, will be specialties that will be reduced probably the most.
In fact, Congresswoman Elaine Luria's office told me when Langley Air Force Hospital announced they would stop accepting new OB/GYN patients this spring in anticipation of closing their maternity ward, Luria challenged the Air Force leadership. The Air Force decided to keep the maternity ward open. But for how long? Senator Mark Warner says he's concerned about the Department of Defense's lack of transparency and consultation with Congress on their proposed cuts. He and Senator Tim Kaine are now asking the DoD for more information. Senator Kaine adding, service members and their loved ones make great sacrifices for our nation, and they deserve our full support. MOA agrees and is concerned that if families are not taken care of at home, worried soldiers and sailors won't be fully focused on their missions.
We also think recruiting and retention may be affected by that,
taking a toll on the health of the military as a whole. Now, the House Armed Services Committee recently voted that DoD make no cuts or other changes to medical personnel until they study the impact. The full House and Senate must still take up this issue and vote on it. Meantime, MOA encourages people to reach out to their Congress members. Stephanie Harris, 10 on your side.